Hello and welcome to LocalLink Hub's podcast, a show with local impact for global change. For those who don't know, LocalLink Hub is the localization and partnership initiative for Terre des hommes. We are a global online platform and we are providing free e-learning and capacity development resources for local and national actors. The project is funded by the Samaha Foundation. I'm your host, Enikő Vass, and I'm the Communication and Content Manager for LocalLink Hub. And thank you for listening to today's episode, Data Thinking, Collect What is Needed, Analyzed and Used. In our second data-related episode, I will be talking with Sukanta Paul from Terre des hommes about what data collection methods could help local organizations evaluate their projects. Technology already changed the way data is collected and analyzed, and my guest recommends a lot of digital tools that ease data collection for small NGOs. We list these tools in the transcript of our podcast. We also touch a bit the ethical considerations of data collecting, and my guest also summarizes the challenges small organizations face and how can they overcome these. Sukanta Paul is Regional Quality and Accountability Advisor at Terre des hommes. With over 13 years of experience in monitoring and evaluation research and development, he holds a master's in public health and has a background in anthropology. My guest specializes in designing quality and accountability systems for projects in Asia, focusing on child protection, health, and social cohesion. He supports TDH delegation in Bangladesh, India, Myanmar, and Nepal, ensuring accountability and innovation. So, hi, Paul. It's really great to have you on our podcast. Today's topic is data, the new oil of the century, and everybody needs data. We can understand on this, small organization, large organizations as well. And I looked up the statistics and I looked up the data. According to the latest estimates, we are producing 402 million terabytes of data per day. So that's a lot.
Yeah.
So today, if we are focusing on small organizations, as you know, and the data they need to evaluate their projects. So in your experience, what are the most effective methods for collecting data in these community-based projects? Do you have some practical examples?
Yeah. So at first, I would like to thank you, Enikő, for inviting me in this podcast. Yes, you are right. I mean, every day we're dealing with data. And what type of data or what type of methods we want to collect, especially depends on what do you want to know. So what is the research? What is the kind of research question here we have? Usually we collect kind of quantitative and qualitative data. Yeah, so quantitatives, and we often also using mixed methods as well. So for quantitative data or for quantitative methods, we usually, want to know some sort of rate or prevalence or ratio. We mainly use survey to collect data, and whereas in qualitative, we use the different types of methods, for instance, in-depth interview or group discussions or key informant interviews. And these are mostly done to explore, some experiences of life, of something, of a person, of a group or a community. So we also use different kind of participatory methods, and we often try to combine them, to get the most out of it. And also there are like different kind of participatory approaches or methods. We can say kind of social mapping, like priority ranking, or life story technique, or like photovoice, or like transit work observation. There are a lot of techniques we often use, to collect data and to get a more nuanced view of the participants. And as you have said, that whether we have some examples. For instance, in the Asia region, we have implemented one action research program on child labor in Bangladesh and in Nepal. And the objective was, to understand the complexity of worst form of child labor in the leather and adult entertainment sector. So we used a lot of methods, quantitative, qualitative, and mixed methods. For instance, like survey was done to identify where to work, actually, which slum we should work on, and the census was done to identify the demographics and socio-economic information and living conditions, for instance. And the life story was collected, to know what are the drivers that really push the children into worst form of child labor. And we have also used innovative method which is called photovoice, which we used actually to answer a question. For instance, what is that? It is that how really COVID-19 impacted the children and their life in their family and their community. So the children have used a mobile phone and they've taken pictures and they've analyzed the pictures with the help of a facilitator. And then they interpreted the whole picture and explained how, what does it mean? You see, we have used a lot of methods, quantitative, qualitative, to better understand, the problem that we want to deal with. But one thing which is common here, whatever methods we choose, we need to ensure that the proper kind of ways or processes are followed, and which is safe and also meaningful to to the participants, to us. And in the whole process, we need to also ensure that we really do not do any harm to the participants.
Yeah, this do not harm is really important during every aspect of an NGO work. So thank you for mentioning it. Technology plays a large part in collecting data, and technology transformed this data collection process for the NGOs. And what are the specific tools or software that you recommend for data collection and data analysis?
As you have said rightly, technology has drastically improved how NGOs collect, analyze, and use data. And it absolutely kind of made our work more efficient, accurate, and secure. So by kind of leveraging the modern tools that NGOs use to better manage the data and also driving insights and enhance the impact of our evaluations. As you have said, we use different tools or software packages, of course, both quantitative and also qualitative. And as I've said earlier, a selection of the tools and the softwares actually it depends on our research question that we want to answer, for instance. For instance, if we would like to do some sort of survey to identify some number or some percentage on something, we do survey, right? So to do the survey, we usually earlier NGOs used to do some sort of paper-based survey using paper as checklist and just tick, and collect. But now we use different sort of softwares like Kobo Toolbox. This is one which is used mostly in the NGO sector. And now, and also Service CTO. This is another software, but is a bit advanced. Say, for instance, this type of software eases the real-time collection of data, entry, and analysis. So, which actually saves a lot of time and help us to decide quickly. But for more advanced level of quantitative data analysis, we use different softwares like SPSS, like Stata. There are also other softwares like R and different others as well. We use this kind of advanced softwares to analyze data, and when we want to publish our findings to some journals, articles, we often use those advanced analysis, and in that case, we need to take help from those advanced softwares. Whereas for qualitative approach, for instance, we usually use audio recorder to transcribe, to record the conversation as now we are doing it. And it helps, to to avoid errors while kind of transcriptions, because we often are unable to keep everything in our memory and also unable to write everything. So while analyzing the qualitative data, we do use different type of softwares, like as I have said, kind of Atlas TI, and also kind of MaxQDA, and also like Deduce. Like these are different softwares, but used for qualitative data analysis. In TDH, we use a MaxQDA. For instance, we use Teams, we use Zoom, we use the Power BI. All these have like different utilities. For instance, like Power BI can help us after you analyze data. Power BI can help us to visualize that data, to make sense, to inform decision making, to see the pictures, the analysis, the graphs, everything. So these are useful ways of helping us to take decisions. I'll give you one example, for instance, like in Bangladesh, we have one project with the Rohingya refugees in Teknaf, where we have health centers in that, and we are using EMR, which is called electronic medical record. So the EMR system is being used in the health settings, in the health centers, and our doctors and our staffs in there, like they're entering all the data in the EMR system. So the whole thing is now automated. So it's really easy and also helpful to analyze, and also helpful to take decisions. And like this is also same for another project, which is on child protection in Ukia, which is also with the Rohingya refugees. So this project actually used CPIMS software, which is of UNHCR, and this software actually collect the case management data. So these are all helpful tools that really help us to do effectively what we are doing actually. So embracing these kind of technological tools are especially useful for NGOs to remain effective, accountable in what we do.
You already mentioned that you are doing a lot of field work, and data collection. I think it's always hard, especially in an emergency context where the privacy may be overlooked, or people forget or cannot collect the consent needed.
Yeah.
So my question would be, what role do ethical considerations play in this data collection and analysis for the NGOs, especially regarding these two aspects, privacy and consent? Can you recommend some best practices?
So every organizations have some policies and tools and processes on how to collect data, what are the standards, what are the protocols, what are the guidelines to use. So a first thing is to follow the guidelines, ethical guidelines, and policies and processes of the organization. For instance, we have to take informed consent, from the children and whoever it is that we're collecting data from. So, and also, also for children, we need to take their assent or informed assent, for instance, as children are minor. So in this case, we have to take the consent from the legal guardian. And after that, we need to go for data collection. So which means we need to follow ethical guidelines in every stages of the project. It's not only while we collect data, it's also on the different other processes that we do with the communities and with the participants. So I can just explain to you, there are some principles that we follow while we take consent or ethical consent or something. So we need to share at first the objective, that why want to collect data. What is the objective of the study or of our work? So what we are going to do with that data? What is the aim of the work? Who we are? Where are we coming from? The risks and benefits, if any. As you know, we should not be doing any harm if we cannot make any benefit. Like it is actually, the do no harm principle. And in this case, we have to be culture sensitive and also locally oriented. As you have said earlier as well, we need to maintain confidentiality and privacy. We cannot share things with others. And we need to protect the data and maintain anonymity of the participants. we need to highlight that participation is voluntary in nature, and we need to respect their time and dignity, of course. And they always have the right to withdraw at any time without asking any question. And if the participation is kind of costing the participants some time, some money, then we have to also compensate the participants for their time in cash or in kind, whatever instance. For instance, if want to talk to children who are working children, working in a factory, and we want them to be with us for a discussion, say for 1 hour, 2 hours, and if they have to surrender their earning for that, then we have to compensate them. This is the ethical principle that we have to follow. So consent can be of like two types. It can be written or it can be verbal as well. One more thing that I would like to highlight actually, as you have said about emergency context, because in the emergency context, things actually change quite rapidly. We often don't get enough time to build trust with the people. So in that case, participants or like community people can act as a witness about when we actually collect data. So they can play an intermediary role as well. And if the research issue is something serious or sensitive, ethical approval should be taken from the respective bodies, ethical review committees like universities, or if the research is something on some sort of clinical aspect, then we have to take ethical approval from a medical council in the countries. So there are some procedures. And when ethical protocols are drafted, we need to keep in mind the emergency context. And the people and the staff should also be trained on the protocol. And then, of course, in the whole process, we need to keep kind of proper follow-up and also field visits to see whether how the research is going, whether there are some feedback or some complaints, on the processes or systems. And one thing is to follow is that the forms or the guidelines or the protocols should be, a simple form and also in the local languages. So we should always consider the context when we do our work or collect data.
I know that it is a lot of work. I see.
Yeah.
Do smaller organizations have this energy and people to collect the necessary data to analyze it properly?
So, as you have said, small organizations, national organizations, or local organizations, to answer this question, actually, we have to understand the context in which they work. They often face multiple challenges in collecting, analyzing data. They also have limited resources. It is both in terms of funding and also personnel. So they may not have dedicated staff to collect data and analysis. So employees often have to juggle between multiple roles, in which work collect data is often deprioritized. So despite these challenges, I see that many small organizations and our partners, they actually understand and recognize the importance of data in our work. So they work collaboratively with other lead and implementing organizations as they want to build their capacity also in that area, as ultimately it can help everybody to be more efficient in the way in which we handle data. As you've discussed before, advances in technology have made the processes of collecting data and analysis more accessible. So like tools, say for instance, like software that we have discussed earlier, different kind of softwares and like cloud-based storage systems, user-friendly analytics software, can really help smaller organizations manage data more efficiently with limited staff as well. And one more thing that I would like to highlight here, that access to funding, specifically for M&E, is actually a game changer. Often the smaller organizations really doesn't keep enough money for M&E or to collect data. So I think in these cases, it will be really helpful for smaller organizations if they can leverage the grants and support from the larger NGOs or international bodies to enhance the data skills. And smaller organizations may prioritize, for instance, like focusing on collecting data only, which is most critical to the needs, and avoid overburdening their staff. They can prioritize what they actually need, what actually be used, and what is actually going to be helpful to take decisions, because we often collect data that we don't use. Yeah, it's a waste of money, it's a waste of resources, of time. So by prioritizing this key metrics, we can ensure that the data we are collecting is actually manageable, and most importantly, which is providing us insights.
Thank you so much for your insights, and hope we can meet again and discuss another data-related topic in the future.
Thanks to you, Enikő, and everybody.
I'm Enikő Vass, and you've been listening to a LocalLink Hub podcast. We had help from Judit Németh-Almási. Thanks to all of you for listening, and thank you, Sukanta Paul, for joining me today on this LocalLink Hub podcast. I hope you enjoyed this episode, and if you want to learn more about Terre des Hommes initiative, please visit our website at locallink.childhub.org. If you have any comments on the episode, contact us via social media on Facebook or LinkedIn, or email us on locallink@childhub.org. Thank you for joining. See you on our next episode.